Hello, Accorda, and welcome to Labour of Love with me, Shiva New York. This is where we cut through all of the unsolicited advice and all of the misinformation online to find out what we actually need to know. This is a podcast for any and all pregnant people out there, whether you're on your first, second, third, or are just starting to think about your pregnancy journey. Hopefully there is something for everyone to learn. I'm currently 32 weeks pregnant and the Lanav has found my ribs. What do you mean you're bouncing off my intercostal muscles? No, Namathon iderasnica. For anyone who did Baholiach Squelga, I did have to Google what the English for that was. Now, I will say my baby is not the biggest mover. They're gentler than what I've heard other people describe, which I'm not going to lie, it did worry me for a bit. I even went and got it checked out once, and the emergency rooms, I have to say, very quick in maternity hospitals. They stuck the CTG on me, they monitored me for 20 minutes, and all was good. So I really would recommend, if anyone's worried about babies' movements, to go and do that. That's what they all say to do. And do you know what? Turns out babies just have less space the more they grow, so the more restricted their movements become. But tell that to my organs, which I'm pretty sure are becoming bruised with all the movement inside. But it's great. I love it. It's a gorgeous feeling, and I am loving this gentle little Lanav already. This week's episode is all about mental health during pregnancy, and I'm going to be speaking to Dr. Jillian Doyle, who is the principal clinical psychologist in the Rotunda and a member of the Psychological Society of Ireland. I think we all know that pregnancy is physically exerting, but what about the emotional toll on our minds? There are a lot of hormonal changes, and throw in on top of that a house, a job, possibly other children and a relationship. It's a lot to think of. It can get very overwhelming. Me personally, while the pregnancy has been an absolute joy, there's been a bit of a dark cloud over me at times because I very suddenly lost my gorgeous sister Una earlier this year. So it's been tough navigating grief while pregnant. There's joy, there's guilt, there's sadness, of course, and there's also excitement. So kind of balancing all of those emotions within one brain, it's tricky, I'm not going to lie, and some days are tougher than others. But I'm sure Jillian will have some advice for anyone else who's in the same boat, as well as other excellent insights into mental health during pregnancy. So let's go ahead and meet Jillian. So thank you so much for joining me today, Jillian. I know you're a busy woman as principal clinical psychologist in the Rotunda. And before we get into the discussion about mental health, can I ask you when mental health started to become incorporated into maternity care in Ireland? Because I imagine they weren't doing this in the 60s.
No, I definitely don't think they were doing it in the 60s. But there was some level of mental health care in some of the hospitals, I think from as far back as the early 90s. But really, there was a sea change coming after 2017 when we got this new model of care for perinatal mental health in Ireland. And so then perinatal mental health teams started getting introduced into the hospitals, the 6 hospitals, big hospitals in Ireland. So Cork, Limerick, Galway, and then the Coombe, the Rotunda and the National Maternity Hospital in Dublin. And each of those hospitals also have a number of spoke sites which have mental health midwives. So there is some level of mental health provision or coverage across the country, although unfortunately currently not every maternity service would have a full mental health team.
Okay. And you work in the Rotunda yourself, so what's that like? Because the Rotunda was the first maternity hospital in the world. What's it like working there?
The Rotunda is a great place to work. I love it. It's a really busy hospital, really dynamic, loads and loads of staff and loads of service users coming in. And in my role, I'm very privileged that I get to work with both birthing people and their babies. So it's a really important job and a real privilege to work there.
And you gave me a really interesting stat just before we came recording about the Rotunda and the birthing figures.
Oh yeah, so the Rotunda is currently the only hospital in Ireland where the birth rate is going up.
Yes, you up the north side.
Yeah.
So let's talk about how many people are affected with mental health issues during pregnancy, because I think we hear all the time about the physical symptoms and the physical things that happen to our bodies, but maybe not so much the mental toll and the emotional toll that pregnancy can have on us.
Yeah, so I think in or around 25% of women will develop or have a mental health difficulty during their pregnancy. And that can be a new mental health difficulty, so something they haven't experienced before, or it can be someone who has had a mental health difficulty and their mental health difficulty is continuing during the pregnancy, or it can be someone who had a mental health difficulty in the past and then it kind of reappears during the pregnancy or postnatal period.
Are you more likely to suffer from mental health issues if you have suffered prior?
Yeah, I think so. I think it's definitely a risk factor. But other risk factors might be if you've had any sort of adverse childhood events or traumatic experiences.
Okay. It's a lot of new hormones coursing through our veins. Of course, there's going to be some emotional changes. What can we expect in terms of our moods and emotions?
So, really interesting things happen in the body and the brain during pregnancy. And one of the things that happens is that your brain becomes much more attuned to the emotions of other people. And so the brain is going through this kind of pruning experience. So I kind of think of it as turning from a Volvo to a Ferrari.
Oh.
But that Ferrari is tuned into the baby. So you are becoming really attuned to emotions. And of course, that means that maybe you're crying at, the Andrex ad on the telly. But the function of it is to notice what's happening with your baby when your baby is born. But then also, I suppose, during pregnancy, you're beginning to think about your identity, to think about your life. And that can also cause sort of momentary changes in, hormones. And for some people, that can be really scary. And so then they might get a peak of stress hormones. And then also how the pregnancy is progressing can have a real impact on the emotional experiences of the pregnancy. So, for example, if you've had something like extreme nausea and vomiting of pregnancy, you're just wrecked. And of course, we know that without good sleep, we're all much more emotionally vulnerable.
Absolutely, yeah. Okay, so you say we're more in tune emotionally when we're pregnant. So does that mean are pregnant women the best empaths in the world? Is that what it is?
Don't know. I suppose it depends what your baseline of empathy is. Gosh, that's such a hard thing to answer because we all have our own unique way of dealing with emotions. But I think certainly, some research has shown that during pregnancy, people are really tuning in to the face, to cues, picking up on emotions, maybe more than they did previously. And there's really interesting studies coming out now. And I heard of one recently where, they were saying that we always thought that the brain changed during pregnancy and then changes back.
Okay.
But it doesn't actually now. It seems that actually some of the changes that happen in terms of emotional attunement actually
they
stay.
Really?
Yeah. And I think that they can now predict, if they show people, they've put pregnant women or people who've been pregnant and people who haven't through different imagery machines, and they can 100% predict the brain that has been pregnant versus the brain that hasn't.
That's a superpower.
I know,
it?
it's
that
cool.
we
Yeah,
it's
like the sense of smell, isn't it? That's the pregnant woman's superpower.
That is incredible. I love that.
Yeah, no, it's really cool.
I love it. I'm going to tell everyone I'm a Ferrari now. Do these mood changes or emotion changes, they differ by trimester?
I think there's some difference, but I wouldn't be kind of pinning my hat to that. The big difference happens after you give birth. Okay. So after you give birth, a lot of women will have the experience of the baby blues, and that's a dip in mood in those early days or weeks postpartum. And that's because your hormones just, take a cliff dive. So all these hormones that have been flowing through your body are suddenly gone. And that can have a real impact on your emotions. I think as the pregnancy progresses, that sort of emotional sensitivity might increase. But, and oxytocin increases. And of course, oxytocin is what we call the love hormone. And that's the hormone that's going to get baby out. And so that's going to be at its highest level as you give birth.
Yeah.
For most people, not for everyone.
Yeah. Because I know the biggest hormonal changes is lots of estrogen, lots of progesterone, but oxytocin, we do experience that during pregnancy as well, not just at birth.
Yeah. And I think that's something that we're often trying to think about stimulating as birth comes. But oxytocin is the hormone of connection. So that can help you both attune to your baby, but also attune to other people.
Gorgeous. So I know you mentioned postpartum, we will get to that. And before we get to maybe the more serious mental health conditions, let's talk support systems. So what do we need around us in pregnancy? And how do we establish our support systems properly? Yeah,
I think, we say it takes a village to raise a baby, but it also takes a village to raise a mum. And so I think having support systems, whether that be sort of family members, if you have a partner, those people who you feel really close to. And, you know, I think the main thing is about feeling that you have people that you can be yourself with, be open with, and let them know what's really going on. I think beyond that, support systems can be things like, what are the things that sustain you and nourish you? And sometimes during pregnancy, you actually have to end up giving up some of those. So for example, like if you were someone who really enjoyed socializing and stayed out until all hours of the night, you're probably not going to be doing that as much during your pregnancy or in the postnatal period. So it might be about thinking about, well, how do I adjust my socializing to make it fit for how I'm feeling now? Or even things like exercise. So, you know, of course, it's absolutely okay to continue on with exercising, but there might be certain types of exercise that you're just not as able to do during pregnancy. And so for some people, it might be letting go of certain things, but then thinking about, well, what is it about that activity that I really enjoy or that gives me a bit of headspace? And is there something else that's similar to it that I can now start doing to mind myself?
Yeah, can I sub something else in for
yeah,
it, you know?
Absolutely, yeah.
And you mentioned their partners, of course. So pregnancy can, of course, affect and alter relationships. I mean, your needs change, your body changes. It makes sense that your relationships would change too.
Yeah, absolutely. Like, I think, you know, we talk about certain like transitions in relationships, like when you get married, when you buy a house, but when you have a baby, that is the biggest transition that, you know, a couple can go through. And because you're bringing another person into the relationship and, you know, like with all that involves and that sense of responsibility, and different people have had different experiences of parenting. So, you know, I think both people kind of independently are starting to think about this and reflect on this as they go through the pregnancy journey. Obviously, the birthing person, their body is changing. They're having this huge experience both internally and externally. Whereas for the other partner, because they're not having that day-to-day change, it might take them a bit longer to actually begin to think, well, who am I going to be afterwards? You know, sometimes people are going through that journey at a different speed. And so there can be mismatches there. I think sometimes, you know, for the woman, things like libido can change. And so, you know, someone who might have had a low libido or a high libido, that might be different. Again, your body can be quite sore during pregnancy. You might just not want to be touched in the same way or as much as you wanted. And that certainly carries through into the postpartum period. So I think it's really important to like have conversations, again, be open. This is what I'm feeling. How are you doing? And if we can give people a little bit of grace that, you know, things might be coming up that they're trying to kind of process or move through, and just to kind of give them a little bit of space and time, that they mightn't be, you know, as calm or regulated as they might be at other times.
So I'm definitely guilty of, I struggle with vocalising how I'm feeling sometimes or asking for help when I need it. I do think I'm getting better, or else my husband is just getting better at reading my mind. I don't know. Okay. It's one of the two. But how can I get better at communicating my emotional needs better during pregnancy?
So I think what can be really helpful is to set a date, like, you know, on a Friday, we're just going to sit down and have a chat about how the week has been and, you know, if there's anything coming up. And so like there's just this point in the week where, you know, we're going to touch base, and this is my opportunity, if I want to talk about something, that I'm going to talk about it. And it doesn't have to be like really awkward, oh, we're now going to have, you know, a big, deep and meaningful conversation, but it can just be an opportunity to be like, I'm really struggling with this, and let's just sit down and, you know, have a nice meal together and chat it through. Because I think we're all so busy nowadays that even in intimate relationships, we're not always having that opportunity to have, you know, big conversations. And I know myself, even in my own home, like you're sitting down maybe for an hour in the evening and you're wrecked. So that's not the time to do it. Whereas if you have an appointment,
Yeah.
Yeah, so I think that's helpful. But then it's about practicing. We need to get used to having certain words in our mouths and just practicing. The more you say, you know, I'm feeling like this or I'm feeling like that, then the easier it will get.
Yeah.
Over time.
Yeah, scheduling in a check-in. I really like the idea of that. And then I have been going through some other emotions today, and I was telling you before that I lost my sister suddenly this year. So I am grieving at the same time as being pregnant. So it's a lot of emotions, and it's juggling them and seeing which ones kind of come out on top that day, and then that kind of dictates how I'm feeling that day. You know, it's guilt, it's joy, it's like, I do think the pregnancy is healing, but it's just a tough situation, and my heart goes out to anyone else who's also going through it, because it is just a tough thing to balance. What advice would you have for people in that situation?
Like, I think the biggest advice for you in your situation and anyone else is to show yourself so much compassion and care. Like, there'll be people who, as they go through their pregnancy, are grieving other babies, people like you who've lost a family member. And I really think, like, pregnancy it's such a powerful time. Like, you're dealing with really, like, raw experiences and emotions, and then you're putting one of life's most difficult experiences alongside that. So it is just to be really gentle and, you know, try to put in place, I suppose, scaffolding. So whether that is, you know, the people in your life who you can talk to, or just taking a bit more time for yourself. You know, I really believe in mindfulness practices, and it doesn't have to be, you know, I'm going to lie on the floor for an hour and do a meditation. It might be like 10 breaths and just like tune in what's going on for me today. But also, you know, just to think about, like, how can I integrate this person who my baby isn't going to know into their life and into my life, and to give that space. And each person will do that differently, and each family will do it differently. But you know, your sister and other people's family members who have died, they're still part of the family. And again, really important to acknowledge them and think about, you know, how is my baby going to know this person who was so important to me, and the sadness of that.
Thanks, Jillian. That's really nice. Oh, excuse me. No, that's lovely. I really appreciate that. Thank you. Okay. And then you had mentioned earlier the kind of the weepiness, and I know it's a stereotype in pregnancy, but it's true, you know, we do get weepy. Exhibit A, you know. But what are the mental health symptoms we should be paying attention to during pregnancy?
So I think, like, there's certain red flags, but the biggest thing is my mental health stopping me from functioning? So if you find, like, some days we will all have a bad day, and it's a day you have to get through, and then the next day is the reset and it feels fine. But if on balance you're having more bad days than good days, and it's impacting things like work or relationships, or if you feel that there's just a self-critic that's on and cannot be tuned out, and it's beginning to impact how you feel about yourself, those are all red flags. And then there's, like, you know, the really big red flags. If you're having thoughts of hurting yourself or hurting someone else, then that's something that just can't be ignored. You really just need to reach out for support or help. But I think that for most people, it's that piece of, is my mental health stopping me from living the life I want to live? And then I think that's the time to ask for support. And if you can, like, don't let it get to the point where there is no other option. Like, ask for support early, so that you can get it in time to, you know, make the changes that you might need to be supported to make.
So what are the steps that someone should take if they suspect that they're feeling a way that is a red flag? What should they do?
So I think the first port of call is your GP. Okay. So your GP will be trained in doing an assessment to see whether this is a mental health difficulty, or whether this is sort of like more of like where social factors have, I suppose, to come together in such a way that life is now getting really difficult, and then they can signpost you to the support you need, or refer you to the mental health professionals who'll be able to kind of support you on the next part of your journey.
And like, if we're talking about things like anxiety and depression, which would normally be treated maybe with a prescription when you're not pregnant, are there safe treatments for them when you are pregnant?
Yeah, absolutely. So there's really safe medications that people can take during pregnancy and while they're breastfeeding. And those prescriptions can be prescribed by a GP, or in some cases someone might have like more of like complex need, and during pregnancy the GP will want that person reviewed by a perinatal psychiatrist, or if some people will be working with a mental health team and their psychiatrist will be able to prescribe for them. And then some people won't want to take medication and won't need to take medication, and then there's lots of different sort of talking therapies or group therapies that are available to support people too.
Great. And you mentioned there perinatal. So perinatal depression is something that I only heard about in the last year for the first time. I think everyone's heard of postpartum, but perinatal, what exactly is that?
So I think so perinatal is that period from conception right through to 1 year postpartum. So perinatal depression is any sort of depression that kind of appears during that period.
And how common would that be, Jill?
Like quite common.
Really?
I think we always hear, people will always say, oh, I've postpartum depression. But I think actually if you look into it, probably there was difficulties with that person's mood or anxiety during the pregnancy. And that's the thing with anxiety, postnatal anxiety, it often starts during the pregnancy as well. So, oftentimes if people are experiencing low mood during the pregnancy, it's important to get it seen at that point.
Yeah, and that must be really hard, because I know we're kind of fed this line that we're meant to be so kind of full of joy and grateful during pregnancy. And I'm sure that's another kind of layer of guilt to how you're feeling if you're then suffering from depression during your pregnancy.
Yeah, I think there's huge expectations on women. And actually, I think some women really enjoy their pregnancy. I think a lot of women, pregnancy is really hard.
Absolutely.
It's physically, intense. You're feeling things, your body is changing in a way it has never changed. So at the very least, it's an intense experience. For a lot of women, it's a difficult experience, and there's so many different things that can happen, like, aches and pains, gestational diabetes, your blood pressure, can go up or down. There's lots of things that people are struggling with during pregnancy.
Yeah, not to mention even just the exhaustion, the flat out exhaustion.
Yeah.
Yeah. And then you can't be doing the things you want to be doing. And like, I know people get signed off work early, is that a good option for people who are feeling like they're struggling?
It's a good option for some people, certainly. Like if work is one of the things that you're really sort of struggling with, and if you are feeling really tired, I think sometimes if we think about labour as a marathon, if you are training for a marathon, you have to drop down your training before the end.
Yes.
And
that makes a lot of sense.
Yeah. So sometimes it does help people just to kind of rest and recuperate and nourish themselves. And then also you will never again have the chance to do that, particularly as a first time mum.
Yeah.
But, that's not to say that that's for everyone either, or, that because some people find work really helpful, and some people with mental health difficulties, actually being able to go to work is a time where they can, just kind of do what they need to do. And, if you're having identity struggles as you move towards being a mum, that can really feel like this is really important to me. So I want to go and I want to do my work. And, so it's just so individual, isn't it? That we couldn't say to every woman, oh no, you shouldn't be at work, because the most important thing is about choice and people feeling empowered.
Yeah. No, I love that, because I definitely want to work for as long as I can while I physically am able to, I'm mentally and I'm able to. So, but I hadn't really considered that it's an important part of identity. I suppose that's probably why I am doing it, so enthusiastically. You mentioned there unrealistic expectations. And I know, like, we are told from such a young age through movies and TV and very well-meaning friends and family, about how our birth is going to be. And I suppose post-birth, if it hasn't gone exactly how you imagined it, there can be obviously a lot of feelings around that.
Yeah, I think so, and I think there's a whole sort of spectrum of feelings, isn't there? Like, because some people will have births that are really difficult and really traumatic, and, either subjectively their own experience of the birth is that it's traumatic, or objectively, something has actually happened, which made that birth really difficult. But then also, as you say, that there's also, like, for some people, the birth on paper will look like it was, absolutely perfect, but they had hoped that the birth would go one way and it didn't, and so they're left feeling really sad or really disappointed, or wondering, what did I do, or did I do something wrong? And I think that that's a really difficult place to be in the postpartum period. And sometimes, like, what can happen is people are comparing themselves to, whether it's friends or, people on TV or people on social media who are talking about these different birth experiences. But the most important thing is that mum and baby, and the other important people in their lives, are coming out of this experience feeling kind of safe and cared for. And I suppose, just to say, if someone comes out of their birthing experiences and is struggling, maybe thinking back, or, having kind of symptoms of trauma, which might be flashbacks or nightmares, that's another kind of red flag that you might need some support. If a lot of people, those symptoms will settle within a few weeks, but if they don't, there's lots of different treatment options.
I suppose I spoke to one person about this recently, and they were like, oh, you're speaking to a mental health professional about this, I want you to bring up this, like, I had one idea in mind for birth, and then it went completely differently, and I felt like a failure. And I was like, that's such a sad word to hear, isn't it?
It's really hard, and I don't think that's that is an experience that can be shared among a lot of people, and I think some people, they've had such a long journey to pregnancy, or someone just so wants this baby, and they're so prepared, and they've thought everything through, and having a birth plan and things like that can be really helpful, and you can do your absolute best to learn everything and know everything, but at the end of the day, birth is one of these experiences that we can't control. So I suppose what I would always suggest to people is, be as prepared as you can be, and then at a certain point hold that so loosely. So just be like, this is how prepared I am. This is the way I'd like it to go. But on the day, I'm going to be really open-minded about, what the choices are. And I'm part of a team, and that team includes the different professionals who are working with you. And so each birthing person is such an expert, such an important part of that team. But every person on that team is an expert in their area. And if that whole team can come together and work together, then birth can be a really kind of powerful experience. But if you can hold the plans loosely, and then afterwards, if you are noticing those thoughts of, I'm a failure, just to really kind of come back and ask yourself, would I say this to a friend, or how would I mind myself?
You'd never say that to your best friend. You'd never say the word failure to them,
No.
Yeah. I am planning on having a birth plan, but I want to have a birth plan for every possible eventuality.
Okay.
So that I feel like I've had a say in whatever way it goes.
Yeah.
So I feel like, well, hopefully that'll help.
Yeah.
Let's talk about after you've given birth, you've met your baby for the first time. And I was on the phone to you during the week, and you mentioned a Disney moment.
Yeah. So I think this is something, again, like, I think we've all grown up watching movies and TV, and, people give birth, and all of a sudden they have just fallen in love with their baby. And that does happen for some people, but it doesn't happen for everyone. So about 25%, so that's a quarter of people, will have some sort of difficulty in those early days bonding with their baby. And I think that that's so normal, because with birth, and I've mentioned it before, this is a new person, and it's a really big responsibility. And so for a lot of people, that responsibility kind of rightly so, kind of weighs heavily and they take it really seriously.
Yeah.
So that might actually be the strongest feeling. Or like you may have had a really long labour or a really short labour, and then suddenly you have this baby and you're absolutely wrecked and all you want to do is fall asleep.
Yeah.
And that's understandable too. So, I think whatever the feelings are, they're just the feelings in that moment. And, absolutely wonderful if it is that feeling of I love my baby. Isn't that fantastic? But if it's not, if it's another feeling, that's okay. Two emotions, they have a function, they're telling you something. But like a baby and their caregivers, like they are in relationship to each other, and that relationship is going to grow and blossom as time goes on. And lots of people in the first 6 weeks are really tired. It's all a little bit kind of like messy. Life gets very messy. And the baby, when they're not kind of interacting, so it can often take a few weeks for babies to start smiling. You're doing a lot of caregiving. So just be really gentle with yourself if you don't have that sort of falling in love or Disney princess moment. And just mind yourself.
Yeah.
And again, if it's something that carries on and is causing you distress, there are lots of services to support you in the relationship with your baby.
I think that's fantastic advice. Now, let's chat a little bit about postpartum mental health. Because I know I've been told I should be booking in with a pelvic floor specialist 6 weeks after birth. Should I be approaching my mental health in the same way?
Well, I wonder, could you like book in with yourself 6 weeks after birth? Like do it that way and kind of say, so 6 weeks after birth, I'm going to sit down with myself. I'm going to kind of have a good like bit of self-talk about how I'm doing. And like, because not everyone is going to need to see, a mental health professional or, a therapist or a counsellor. Some people might, but like even like don't wait 6 weeks to do that. Do that after 2 or 3 weeks. Like, and then you can ask yourself some really kind of basic questions like, how's my sleep? And if your sleep is really, really bad, like that is the first port of call. We need to protect our sleep. And, I always think like the golden number is if you can get like at least 1 3 or 4 hour stretch in a night.
Not all.
Yeah. And after that, it's diminishing returns. But like at least then you've got one sleep cycle.
Yeah.
But if you're functioning on no sleep, it is going to have an impact on your mental health. That's the reality. And then things like begin to ask yourself, like, how's my self-care? And like by self-care, I don't mean, am I brushing my hair? I mean, like, am I getting 5 minutes to like sit down, relax? Am I getting to do things that nourish me? And like for one person, that might be like doing their skincare ritual. Someone else, it might be going for a walk. But those little things, they don't have to be big things, but the small things that just kind of nourish and sustain. Am I getting to like meet a friend for coffee, whether that's them coming to you or you going to them? Or do I feel that I'm kind of up to 90 all the time and I'm not doing anything for myself, and I've my baby is literally with me 24/7, and some babies will want to be with you 24/7, and that's something that people are often happy to do. But is there a moment like in that kind of 23 hours, 40 minutes, those 20 minutes where someone else could hold the baby and you just get a few minutes? And other things like, am I eating? So people will often say, I'm too busy to eat. And I often think, well, could someone else support you by kind of helping you meal prep? Or like maybe you're someone who really likes to eat healthily, but it's okay in that period, you just need some nourishment. So if it's ready meals, or it's a really good present, if someone is asking you, what would you like me to get you, as a baby present, say, well, get me one of those like a voucher for meal delivery for a week. Or I know when I had my kids, my rule was always, you're welcome to visit, but you have to feed me. So everyone brought me a dinner.
I love that.
Yeah. So like things like that, but just to think what like supports and sustains me.
So what can partners do post birth to keep an eye on the birthing partner's mental health?
Like I think talk to the partner, just keep checking in, let them know that you're there for them. Depending on, how the mother is feeding the baby, maybe the partner can do one of the feeds. If the baby's being formula fed, if the baby's being breastfed, then obviously the person who's breastfeeding has to do the breastfeeding unless they're pumping. And in that case, maybe the partner can give one bottle. But even if someone is breastfeeding, there might be like a time in the night where, like, say, mum can breastfeed and then she goes straight up to bed and the partner will do the burping and the changing and keep baby down with them for that first kind of long stretch. So generally the first stretch of the night is the longest stretch a baby will get. So if kind of the mum can go and get some sleep there. So those kind of things. And then oftentimes the partner is keeping the house ticking. And I think the big thing is, so sometimes people will say to me, well, I'm not working, so I'm doing it all. But like, no one works 24/7. Most people work some sort of in the realm of 9 to 5. So when the partner comes home from work, then there are two people on the baby. And so both people can tag team. And I think if you can get that sort of sorted, then it stops things like resentment or absolute exhaustion setting in.
Yeah, I actually saw someone saying on social media recently about that, about, the mother being off work and kind of doing the lion's share in the house as well. But then the partner being like, I can be tired in work. I don't want you to be tired while you're looking after the baby, So prioritising that between the two of them to decide who does what.
Yeah, as best people can. And I think oftentimes the person who isn't working is probably doing the bulk of the nights because, maybe they don't have to be up at the same time. But does that have to be done at weekends? Probably not in the same way. So it is just about having these conversations and trying to have them in advance of baby arriving, because every conversation is more difficult when people are tired.
Okay, post-baby. Okay, so have all the difficult ones before the baby
Before
arrives.
the baby, yeah.
Okay,
yeah,
great.
yeah.
Well, Jillian, thank you so much for joining me today. That was absolutely invaluable. I'm going to be taking on so many of your tips. Thanks a million.
Brilliant. Thank you so much and best of luck.
That was such an eye-opening conversation. I hope you enjoyed it at home. I hope you learned something from it. I learned so much. And while mental health mightn't be maybe one of the most obvious topics to cover within 6 episodes, I felt like it was one of the most important. I actually didn't even realise until Jillian said that 25% of pregnant women do suffer from mental health issues during pregnancy. So if anyone has listened today and has thought, maybe that's me, please do speak to your caregiver or your doctor and just start the conversation with your support system as well, because it's so important that we mind ourselves during this transitional period in our lives. Next week on the podcast, I'm going to be chatting to home birth midwife Sarah McCann about labour and our choices in labour. The closer I get to my due date, the more excited I get about it. So I am just buzzing to jump in and to discuss this with Sarah next week. I did do Sarah's antenatal courses recently and I think she's amazing. And she may or may not call us all goddesses, which I really enjoy. Thank you so much for listening to Labour of Love. And if you are on a pregnancy journey as well, remember we are 1 week closer to meeting our baba. Gurmí na mágwibh slán go fóill, and I'll chat to you next week.